So today we're gonna start structure and metabolic characteristics of the different areas of the gingival epithelium. So let's start. Bismillahirrahmanirrahim. So basically, they are saying that we will study the gingiva has components too, like epithelium and the connective tissue. In this we are studying epithelium. So they are saying that the epithelium component of the gingiva shows regional morphologic variations, means that the morphology is according to the tissue that adopt to the tooth and alveolar bone. Okay, and then they have variations, like they have oral epithelium, sulcular epithelium, and the junctional epithelium. Whereas oral epithelium and sulcular epithelium are more protective in function. So okay, and the junctional epithelium has role in the regulation of the tissue health. Well, they regulate the tissue health. uh, Means it allow the fluid to enter in the tissues, and it basically helps in the regulation of the tissue health. Basically, it is recognized that the it is now recognized that the epithelium cells were not passive bystanders. Means they were considered that the epithelium cells do not take part in any of the thing in the gingival tissue, but now they are metabolically active and capable of reacting to external stimuli by, of course, releasing the or synthesizing the cytokines, adhesion molecules, and growth factors and enzymes. And they are saying that the degree of the gingival characterization diminishes with the age and monopause. It is, and they are, but they are also saying that it is, you cannot say it is related to the phases of menstrual cycle. Keratinization of the oral mucosa varies in different areas, like the palate is the most keratinized. We have most keratinized, then the gingiva we have, then the ventral aspects of the tongue, and then the last is the cheeks are least keratinized in this aspect we have. Okay, now the most important outer epithelium, which I've also studied in the previous, that you can go in the previous videos. So I have told what is oral epithelium, in diagram what is sulcular epithelium and junctional epithelium. Okay, so basically, the oral or the outer epithelium that covers the crust and the outer surface of the marginal gingiva. Yes, in the previous videos I have also shown you that basically we have the, when there is a tooth, means there is a tooth, and when there is an so there this is a junction, there is the outer epithelium which covers the crust and the outer surface of the marginal gingiva. Okay, and also the surface of the attached gingiva. On average, zero point 0.2 to zero point 0.3 millimeter in thickness. It is this much, and it is keratinized or parakeratinized. Basically, is a combination of both. It depends on the condition. The prevalent surface, however, is more the protective or the prevalent surface is more parakeratinized, means it will be more protective. The the oral epithelium is composed of the stratum basal, stratum spinosum, and stratum granulosum, and also stratum corneum layer. It is composed of these four layers. So one most important, it protect the crust and outer surface of the marginal gingiva, means free gingiva, and also attached gingiva. Zero point 0.2 to zero point 0.3 millimeter in thickness. It is either keratinized or parakeratinized. The prevalent surface is parakeratinized, and it has the oral epithelium is composed of four layers, that is basal layer, stratum basal, and stratum spinosum, and stratum granulosum, and stratum corneum layer, means it is keratinized. Okay, so now we are going to start the sulcular epithelium. So sulcular epithelium basically is the that lines the gingival sulcus. It is a non-keratinized stratified squamous epithelium without retipegs. It has no retipegs, and number one, it is a non-keratinized because it is also in contact in the tooth. It extends from the coronal limit of the junctional epithelium to the crust of the gingival margin. It is usually shows many cells with the hydrophobic degeneration. What is hydrophobic degeneration? It is actually basically the cellular degeneration in which the water accumulates within the cells. Despite of morphological and chemical characteristics, the sulcular epithelium has potential to keratinized. Basically, they have said that due to morphology and some chemical properties, the sulcular epithelium has still potential of keratinization. It is reflect if it is reflected and exposed to the oral cavity. If the sulcular epithelium is exposed to the oral cavity, then it may keratinize for protection. If the bacterial flora of the sulcus is totally eliminated, or if the bacterial flora of the sulcus is totally eliminated. However, the outer epithelium loses keratinization when it is placed in contact with the tooth. कहते हैं the outer epithelium, what we have said in a previous video, in the previous, it can lose its keratinization when it is placed in the tooth. So the findings and the study suggest that irritation to the sulcus prevents its keratinization. The sulcular epithelium is semi-permeable, which is very important for the entry of the injurious bacterial products pass into a gingiva, or through which the tissue fluid from the gingiva sips into the sulcus. But not like junctional epithelium. It is not heavily infiltrated with morphonuclear neutrophils, leukocytes, and it appears to be less permeable. It is not like junctional epithelium. It is less permeable. Okay.